My name is Tanya Smith, and I'm a doctor of traditional Chinese medicine. I work with women throughout their reproductive life cycle, from fertility to pregnancy and then to postpartum, as well as with any menstrual issues they might be having and all the way on to menopause. I do this using traditional Chinese medicine, which involves the use of acupuncture, moxibustion, and Chinese herbal medicine to effect change in the body in a natural and holistic way. And once I found out about how Chinese medicine works, how it pulls in all the different aspects of your life, your lifestyle, the things you eat, the exercise you take, the amount of stress, your relationships, how it includes all of that into your picture of health. I knew that this really made sense to me as a way of taking care of your health and as a way of being well. I'm so passionate about my job. I think it is the opportunity to offer an option to people with their health care. Being raised in a Western medical framework, we don't often consider how important each part of our lives is in our overall health. And to watch people awaken to this awareness is really, really exciting for me. I would actually say that there are no typical days as a Chinese medicine practitioner. Sometimes my days can look very similar to one another, where I will come in, I will see clients, I will do the aspects of taking care of the business part of my work. But each interaction with each client is always different. Each individual brings with them their collection of life experiences and their set of expectations for our work together. And I may see one fertility client, and then the next client is nearing her birth date with her pregnancy, and then I may see a menopausal client next, and so it's constantly changing, and the one-on-one interactions are really what keeps it fresh for me. In order to enter into Chinese medicine school, you require 2 years of post-secondary training in some related fields, so generally biology or pre-med studies. And then there's 5 years training to become a doctor of traditional Chinese medicine. The special skills that you need to be an acupuncturist are taught to you at school, a lot of them. You learn how to apply needles, you learn how to feel the body for different things, you learn how to prescribe herbs for somebody's different disharmony. The special skills that you need to bring to the work that you can't learn at school have to do more with your heart, having to do more with how compassionate you are and how much you care about people. And I think probably the most important one is just how to listen to somebody so that they feel heard, so that that is a therapeutic relationship for them, and how to listen to somebody so that you can tease out the details of their case that will allow you to make your treatment very specific and very focused for that person. All sorts of people become acupuncturists and Chinese medicine practitioners. But it generally takes somebody who thinks outside the box a little bit. Somebody who can expand their worldview enough to allow the concepts of Chinese medicine in, because it's a very different way of looking at the world than we're used to in terms of cause and effect, and sort of a Western framework of thinking. It's very, very different. One of the really unfortunate things about becoming an acupuncturist is that there are no jobs as an acupuncturist. We really have to pave our own way and create our own job, which generally means starting a small business, either with a group of other practitioners or on your own. So work hours don't just involve the time that you're with clients. It also involves all of the planning, all of the promotion, all of the networking, and working to build up the business side of your practice as well. So work hours tend to be long and varied. I think the most rewarding thing about what I do is seeing change. Sometimes clients will come in with a positive pregnancy test after we've been trying for many months to help them get pregnant, and that is really rewarding. Sometimes a client will come in and tell me that she had no pain with her last menstrual cycle, and that is really rewarding. So to see change happen and to really feel like the women that I'm working with are empowered and understand their influence in their health, but also understand that they can affect change, that they don't have to give over their bodies to medicine in any way and have something done to them, but that they can be an active participant in their healing. That's, I think, probably the most rewarding thing, and then to see the results come out of it. There's potential to make a very good living being an acupuncturist. The skill set required to make a very good living being an acupuncturist has nothing to do with acupuncture. It really has a lot to do with your business acumen, with how well you can set up and establish and run a business. As alternative medicine continues to expand and grow in scope and in public knowledge and public usage of it, the market for what I do expands tremendously.